Meghalaya now, the State Chief Minister Conrad Sangma today said that his government has made necessary arrangements for life support and ventilators to treat COVID-19 cases. And talking to Northeast Live, Conrad Sangma maintained that quarantine is the primary need for treatment of COVID-19 cases, as majority of them have mild symptoms and are asymptomatic. When asked as to how much the state government will be able to handle COVID-19 cases, Conrad Sangma said that this depends on how many critical cases comes up. He also said that 70 to 80 life support systems with ventilators are there across the state, in addition to 200 basic ventilators. Earlier, Chief Minister Conrad Sangma had a review meeting with Deputy Chief Minister Preston Tinsong, Home Minister Lakshman Rimbui, Chief Secretary MS Rao and top officials of the Health Department.
What we call it's an open thing. We cannot say that one is capable of handling this number, that number. In fact, situation is such where we would hope that numbers won't go up. What is important to understand, and which we're trying to clarify to everybody, that it is important to understand that maybe somebody might be positive, but the symptoms may be mild. So what is important is that the serious cases which require life support and ventilation are the ones where the system has to be there to support them. Most of the cases throughout the world have been mild symptoms and asymptomatic, which means they don't need any kind of medical attention. They just need to quarantine, set themselves at home. They are all feeling quite okay, stable. And so therefore, really to answer your question, what it is, it depends on the critical cases that come up. And so therefore, from the life support and from ventilation, all these points of view, different arrangements have been made, as mentioned earlier in the past records. I don't have the exact numbers with me, but close to about 70 to 80 life support systems with ventilators are there throughout the state. And more importantly, then almost about 200 are there, which are basic ventilations, which are not life support systems, but will help in supplying oxygen. And really, for the other cases which are there, which we, if there are any positive cases more, then most of them we expect them to be mild, which will require quarantine.